Hello and welcome to Medical Dialogues. I'm Dr. Bhumika Makhuri. Here's what I bring to you all from the world of medicine. Swimming in lakes linked to Legionnaires disease risk. Study warns. Swimming in some lakes with still water can lead to infection with Legionella, bacteria that can cause pneumonia, and people who engage in open water swimming should be aware of this risk, reveals a practice article published in the Canadian Medical Association Journal. Legionella infection represents a public health hazard owing to its ability to spread through exposure to natural water bodies and human-made water reservoirs, writes Dr. Ashley Bryson, an internal medicine resident at the University of Manitoba, with co-authors. Legionella infection is an atypical cause of community-acquired pneumonia. Referred to as Legionnaires disease, it presents with fever, fatigue, respiratory symptoms, and sometimes diarrhea. High SPP1 levels in macrophages link environmental pollution to emphysema development. Key finding for COPD. Chronic obstructive pulmonary disease, COPD, is an inflammatory disease characterized by airway obstruction and loss of alveolar surface, together resulting in progressive and irreversible airflow limitations and shortage of breath. Chronic bronchitis and emphysema are two major phenotypes of the disease. Cigarette smoke, CS, is a long-known cause of COPD, and it accounts for more than 70% of COPD cases, as reported by WHO. But the contribution of indoor and outdoor air pollution is increasingly acknowledged. By analyzing multiple emphysema and COPD patient datasets, SPP1 is significantly upregulated in the lungs of patients compared to healthy individuals. Study shows fitness apps may contribute to disordered eating behaviors. With New Year resolutions in full swing and health tracking apps at our fingertips, new research reveals concerning links between health and fitness apps and disordered eating, body image concerns, and excessive exercise. Diet and fitness apps are marketed as tools to improve health. However, they may also have unintended negative consequences, such as creating pressure to meet goals, concerns about body image, as well as provoking feelings of guilt if goals aren't achieved, says Ms. Isabella Anderberg in the College of Education, Psychology, and Social Work. The use of diet and fitness apps is common among young adults, with an estimated 311 million people using health apps to track their meals, calories, and exercise. Survey reveals 90% support for genetic testing to personalize medication use. Pharmacogenomics, an individual's genetic response to medications, is an increasingly important strand of personalized healthcare, but little is known about the public's views on it. New research shows almost 90% of people in England would agree to genetic testing to get the most effective medication and reduce the risk of side effects. How a person responds to medication is sometimes influenced by their genetic makeup. Some medications do not work as well for people with certain genetic variations, and in other cases can lead to serious side effects. To gauge the public's attitudes on pharmacogenetics, a research team led by Dr. Emma McGovern at Queen Mary University of London in collaboration with the National Centre for Social Research, NATCEN, surveyed a representative sample of UK adults. That's all for today. Stay tuned to Medical Dialogues for latest update.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.